All right, we're going to get started, and wow, it's got a big crowd. It must be the rain. People who are thinking, oh, well, the weather's terrible. I might as well go listen to Jim Mancini at Autism 200 tonight. So I'm glad everybody's here. Welcome. If you've been around, my name is, you've probably seen me. My name is Jim Mancini. I'm the parent education coordinator at the Autism Center here at Seattle Children's. And I'm also a speech-language pathologist, and tonight I'm going to be talking more about communication and social communication specifically. So, we do have video teleconferencing sites all across Washington into Oregon, and we have a new site in Wasilla, Alaska. So I just wanted to say hello to them and welcome them to the show. And if anybody was really observant, you'll notice that on the cover it says tonight is August 15th, 3013. So, but I just want to make sure everyone knows that you are at the right time today. So, we're going to talk about social communication. And this is just a huge topic, right? I mean, we could spend days and days talking about what social communication is, and I'm going to try to do it in about 90 minutes, all right? So we might as well just try to jump in and get started. And our objective for today is first and foremost just to define what this term means. And a lot of times people ask me, well, what is social communication? And sometimes it's hard for us to define that. So that's what we're going to start with by presenting a model from the University of Washington Speech and Hearing Sciences Department. We'll talk very briefly about the evaluation of social communication, and then really what I want to spend the bulk of our evening is talking about what those delays and differences are in children who are on the autism spectrum, because what we know is social communication is almost half of what autism is, right? If you think about the two different areas of autism, now half of it is social communication. So it used to be just a third, right? But now we've got it as a half. All right, so we'll talk a little bit about what those delays and differences are and how social communication deficits manifest themselves as kids grow up, right? So we'll start with a very young age, and then we'll go all the way into conversational abilities. So obviously I can't talk about every little facet of social communication across the lifespan, but what I really want to do is kind of highlight some of those really tricky deficits, right? The ones that seem like they're really quite difficult to identify and to help to target. And what I want to do that is to try to provide some strategies that teachers can use, that families can use. So can I just get a show of hands quickly about parents of children with autism? Just kind of raise your hands. Terrific. I'm glad everyone's here. Teachers? Great. Any specialized therapists, speech therapists, occupational therapists? Great. Thank you. Nurses or doctors? Awesome. Anyone else? Caregivers. Thank you. Anybody else? You guys, you didn't raise your hand. Behavior specialists. Thank you. Sorry, I didn't add that group. So I'm not gonna, you'll look through your handout here. And these, I do include the new characteristics, the new descriptors for the DSM-5 for autism spectrum disorder. I'm not going to spend our time going through these. They're here for you to take a look at. If you look at, in this first slide here, I would just, why don't you just kind of read through that while I'm talking a little bit. And this is the basis on which what we're going to be talking about tonight. Okay, so. The first four slides are really just coming from the new DSM-5 describing how, sort of this new definition for making the diagnosis of autism spectrum disorder, okay? So the first was the social communication. These are these restricted and repetitive patterns of behavior that the new definition is presenting. A couple of notes: symptoms must be present at an early developmental period, but this is interesting, but may not become apparent until the social demands exceed the child's limited capacity, or they may be masked by learned strategies later in life. Okay, this is a really kind of important part, because what we sometimes see is children have some of these early deficits, but we don't recognize them as being an issue until kids get a little bit older. And this is something that we often see when kids who are, quote unquote higher functioning, mild autism spectrum, and we may not see those deficits presenting themselves until they are going to school, and you start realizing, oh, they're having a hard time interacting with other kids, they're having a hard time interacting with their teachers, following along with what's going on in the context of the classroom. Okay, and then there is this language impairment, which used to be part of the DSM-4, is no longer part of the DSM-5. Okay, so how that is being described is when we make a diagnosis of autism spectrum disorder, now we're going to specify if it is with or without accompanying language impairment. Okay, because what we know is some children do have what we think of as a language impairment. And by language, I'm referring to vocabulary, I'm referring to the ability to use grammar, okay? A lot of times people just throw those words around kind of interchangeably. Speech, communication, language, right? But as a speech-language pathologist, I think of those things as very, very different, okay? And we're going to talk a little bit about those differences just in a minute. So what I really want to talk a little bit about, and why I put this up here, was to really just discuss the implications of this new diagnosis, right? How social communication has been defined in terms of the DSM-5, and as an aside, there's a brand new disorder that's called social communication (parentheses pragmatic disorder). Okay, and that's the code right there if everybody's interested. And how this has changed a little bit, especially for communication-based therapies, speech-language therapies. If you think about speech-language therapy in the public schools, very often it was a language-based deficit, maybe even a speech-based deficit, which means being able to produce the sounds. But what this is really doing here, and I think that's what we're going to see, is a movement towards identifying these broader social communication deficits. Okay, and I think we're going to see some changes. We're going to have to do a little bit of thinking about how are we going to do a better job of targeting social communication broadly within the context of school programs, as well as how we look at community-based services as well. Okay, and the next couple of slides just has that social communication disorder. Again, I'm not going to go through it point by point, but the main difference here is, and what this does in this particular definition, is it helps really describe what we're talking about when we're thinking about what social communication is. Now here it is. We've described it. It's the social communication disorder is what social communication is. And in this description actually does a little bit better job than even the autism spectrum disorder description in terms of what is social communication. Okay, so the main difference between social communication or pragmatic communication disorder and autism is this doesn't have the presence of the repetitive behaviors or the restricted interests, right? So some children who may have had a diagnosis of autism, right, but they don't have the repetitive behaviors. They don't have the history of a repetitive behavior. This may be a better way to describe those kids. Okay? Yes, please.
So now that this is added in the DSM, will these kids who are identified with this start qualifying for services and therapies in the school?
That's a great question. I think that's going to depend on your school, but I think they should. If you're asking me if I think they should, then the answer is yes. Okay? So, and I think that's one of the implications of this new disorder, is that no longer are we going to just have to say, oh, well, he doesn't qualify because his language isn't bad enough. If they have a diagnosis of social communication disorder, that should be enough to qualify them for services that are going to be, and goals that are targeting social communication. Okay, great question. So any other questions about this DSM-5 social communication disorder while we're on it? Because I'm going to move quickly into the model. Okay. So, and before I hit the model, I should just say we're going to one of the big things, one of the big ideas that is really important to understand is this concept of social reciprocity, right? In many ways, deficits in social reciprocity that's what autism is, right? And what is social reciprocity? I like to kind of define it right here at the beginning, because we're going to come back to these words, this word reciprocal I'm going to use kind of throughout the evening. So social reciprocity is the ability to both socially respond, socially initiate, and manage interactions in a give and take manner, okay? And what we often see is children with ASD can either respond fairly well, maybe they can initiate pretty well, but what they have difficulty is sustaining the reciprocity, okay? So you might be able to do it, they might be able to do it just for a moment, right? But it's the ability to sustain a reciprocal interaction across turns. That's what we want to be able to do. And this is what we see as being hard for lots of children with autism. Doesn't matter if you're a 2-year-old or if you're 17 years old, this is something that we often see as being challenging, right, and an obstacle. So, and this gets its own slide for itself, right? Because what social communication depends on is the context, okay? And that's what makes it so hard to evaluate, right? It's what makes it so hard for people with autism across the lifespan, is that there's no rule, right? There's no exact, this is what you should do or say given every single situation, right? That what we need to be able to do is adapt to the context, okay? And when there's no sort of specific thing to do or say, that's what's challenging, okay? And somehow we manage to do it, right? The rest of us, all of us who don't have a diagnosis of autism, we are able to manage these social interactions, right? We have an idea because of our experiences, right? We have an idea because someone's told us what we ought to do, right? And even though this new interaction isn't exactly like this old interaction, it's still, I can make some decisions based on my experience, based on my knowledge, right? And that's what can be very challenging for people who are on the spectrum, okay? So this is a model that is, it's available right there at the University of Washington Speech and Hearing Department. And what this does, I like how this visually represents kind of the different components of what goes into social communication, okay? And what we're going to do, you've got a nice visual here, but what I'm going to do is we're going to describe and kind of define each of these boxes so that you can kind of get a sense of what is important and what each of these areas entail. Because when you have an idea of what these things are, then you can kind of start thinking, oh, well, that's what's hard for my kid, right? That area is what is challenging. They might have strengths in some of these areas, right? But they might have relative weaknesses as well, which is really important to identify when we're thinking about how we're going to create a treatment plan, right? What are the goals that we want on our IEP, right? What are we going to target at home and at school, okay? So we'll start with this first box, which is the bottom box, and it refers to executive functioning and processing abilities, all right? So, and we could we had a whole 90-minute lecture on executive functioning last year here, right? So we could spend a lot of time talking about that, but I'm going to just spend a couple of minutes talking about it. And what executive functioning kind of is in a sort of a nutshell is the ability for a person to kind of access, utilize what their social knowledge and world experience, okay? So you are able to take in information, okay? This happens all day, every day, right? Something happens, you need to process that, take in that information, kind of organize, make sense of what it is, whether it's verbal because of what someone says, or nonverbal, right? By their facial expressions, by their body language, right? You need to be able to take the perspective of that person. You need to know what they're thinking or what they're feeling, or at least have a guess about what they know or what they think, right? And then what you need to do is be able to formulate a response, a contingent response. And a contingent response is something that is based on what the other person said, okay? So someone says something, I have to listen, I have to pay attention, I have to think about what that is, I have to kind of ask myself in a split second, what do I know about this, right? Do I have any experience with this? And then I have to decide what am I going to do and what am I going to say. So I formulate a contingent response based on what that person said, and then it goes back and forth like a dance, right? Very challenging when we think about the difficulty that a lot of children with autism have with things like this, with mental organization, by being able to take perspectives of other people, okay? So that's kind of what executive functioning is. Any questions about that? Does that make sense? Okay. So, and then processing really refers to that ability just to take that information in, right? Auditory processing through your ears. Visual processing using your eyes. And if you don't use your eyes to learn about social interactions, then you're going to have a problem with that, right? Other sensory processing and what we call sensory integration, which again, I could spend 90 minutes talking about, right? Just the ability to attend and not get distracted by something over here, or not get distracted by this faint buzzing that I hear over to my left that's starting to bother me a little bit, okay? And then finally, especially at an early age, this ability to share attention, right? And we're going to talk a lot about that when we get to sort of some of the younger the kids and some of the issues that we see. Okay, so that makes sense. There's that. First, you have to process the information. Then you have to take that information in and decide what you're going to do with it. You organize it. All right. So that's the first box. So if you remember, I guess it was the left side was this box called social cognition. And what social cognition is just these social rules. What to do, what to say. These are the things that we learn through experience. We learn because our parents tell us. We learn because we make mistakes when we're kids and realize that's not the right way to act, right? So it's knowing what to do or say given a situation and knowing how to modify what you say based on the context. You might say something differently to a teacher than you do to a child, a peer, right? You might have a different something, you have a different greeting to an adult you've never met before than to your grandmother, right? So all these things we have to be able to kind of know what the social rule is given this situation, all right? So that's what social cognition is. Very often, children with autism can tell you what to do or say, what you should do or say given a social situation. You say, what do you do when you walk into the classroom in the morning? Right? They say, oh, you're supposed to say hello, but they may not do that given the opportunity, okay? For whatever reason, that's not happening, okay? So that's really important information when we're thinking about what we're going to do in terms of a plan. And then this is the only slide I'm going to use to talk about language for the entire evening, okay? And, as a speech-language pathologist, that might seem strange, but this is it, all right? So let's talk really quickly. We talked about this idea of communication, right? But one of those components is just being able to have the words, right? Language is a symbol, right? Language is a symbolic system, right? So that involves your ability to understand words from other people and then turn around and be able to produce or express those words, okay? And there's two kind of main components here. One is vocabulary, which refers to word meanings. Okay, and then the next, after you have some vocabulary words, then you have to use the rules that govern the language that you speak to put those words together in a meaningful way, which we call grammar or syntax. Okay, so kind of quick example is, if I say the word apple, right, it really is just a symbol for a thing. Right? So when I say that word apple, people can picture what I'm talking about. You have this picture of this thing in your mind, right? But if I say the word pinguo, right? Does anyone know what that means? It means apple, thank you. In Mandarin, right? So if you spoke Mandarin, you'd have that symbol. But if you don't speak Mandarin, that symbol is meaningless to you. Okay? That's one component. This is what children need to be able to do. And that can be really hard for some children who have autism, is really just learning the rules, learning the symbols, right, for what language is. All right, so you have to be able to take in information, kind of know what to do it, organize it. You have to sort of know what the social rules are, and then you have to have the language to be able to use to be able to understand what someone's saying, as well as to be able to express what you want to say in response to that person. Okay? And then along with that is this idea of nonverbal communication. Okay? So there's language, but then we have what's the half of language is half of communication, I should say, is how we communicate nonverbally, right? If you've ever been in another country and you don't speak the language, you do a lot of gesturing. You do a lot of attempts to try to communicate using gestures and nonverbal communication, your eyes, your facial expressions, right? And that's what we do. We need to be able to do that, right? By using all of these things here, okay? So that's another important component. And then that all comes together in what we think of as social communication, all right? So what social communication is this ability to use, this putting it all together, right? Using language, using nonverbal communication, using your eyes to see what someone else is saying, what someone else is doing or saying, right? To be able to use those things to communicate socially within the context, right? And it involves this coordination to be able to use words, to be able to use gestures, facial expressions, right? Eye contact, the communication of affect, right? And you have to be able to understand all these things as well as be able to go ahead and output those and produce those things as well. So it's this tricky thing, right? This ability to do all this stuff at once, right? Some of which is quite subtle. And that's where we often see difficulties in people who are on the spectrum, okay? So I got a picture here, and here's where I kind of just throw out some questions to you. So, there's no words here. There's no audio, right? But you see this guy, and what do you think? What is he trying to communicate? Anyone? He's happy, right? He's got a nice big smile on his face. I have something, right? And maybe I want to share this with you. I want to show you. I've got something here. I've got this baby doll, right? He's looking, he's making eye contact. There's a lot that's going on here, right? He's expressing affect. He's expressing happiness, right? He's holding up something up. He's using a gesture, right, to communicate, hey, look at this baby doll, right? And he's got a big, he's making eye contact so that that he's engaged with you or connected with you, okay? So this is what we need. This is, he's, 2-3 years old right here, okay? This is what we need to be able to do. And a lot of kids with autism struggle with that, right? Okay, so that's social communication in, 20 minutes. So, any questions about that? Does that make sense to everybody? Happy to answer questions now. Okay. Yes, please.
I have a question that's more of a comment. Back to what you were saying about context and how difficult it is.
Mm-hmm.
When you bring culture into it,
Mm-hmm.
I feel like it complicates it even
That's
further.
right.
Because there isn't just one normative way necessarily of looking at this so-called context, depending on who's looking, who's participating within this context, and how the interpretations are being made.
Absolutely. That's right. Then the comment was, within context, when you add culture and varying cultures into the mix there, it's just ripe for misinterpretation, or it just increases the complexity there. And of course, we live in this great multicultural society, which there's lots of opportunities for misinterpretation, right? So yes, good comment. Any other questions or comments? Okay, so I'm going to spend just a couple of minutes talking about the evaluation. I don't want to get kind of bogged down on this. The take-home message here is assessing social communication is hard, right? It can be very problematic because what we have, the assessment tools that we have to evaluate communication, and I'm using more words like language and speech here, don't adequately capture these deficits that we see socially, right? You have to be able to, how do you assess these without sort of looking at the broader context? And our traditional communication evaluation is a speech language pathologist, that's an adult in a room usually a nice quiet room, free of distractions, right? And doing some tests that involve a lot of pictures, right? So you're really working on the strengths here, right? We're working to these kids' strengths. They might have, there's some nice visuals here that provide some nice support and some cues, right? You got a nice quiet room free of sort of sensory issues or distraction, right? And sometimes we see kids doing fairly well in that setting, okay? So what we really need to do is examine social communication in the relevant social context. So observations within the classroom, right? Observations with interacting with other kids, right? How they communicate and why they communicate, right? So that's what we want to, that's what we've got to be able to do, right, in order to adequately evaluate social communication. So we very often, schools need standardized testing, right? That a lot of school districts require a score, and the score has to be bad enough for the child to qualify, right? And a lot of the times our children with autism, they get that vocabulary, right? Their grammar is okay, right? Sometimes those tests kind of may even overestimate language abilities at a very early age, like the PLS 4. I feel like has some, so can not pick up on some of these subtle aspects of social communication. Okay, as I said, they provide visuals. Sometimes they just require short answers on a test, and they miss out on the social communication. One thing that drives me crazy, right? When I get an IEP or I get an evaluation, and the evaluation has targeted one specific area of communication, right? So I use the example of the Peabody Picture Vocabulary Test here. And what that test does is it looks at one-word receptive vocabulary skills, right? And if you're going to find a strength in children with autism, that's it, right? Their ability to identify one picture out of 4 when someone says the word, okay? And I've seen evaluation reports that say, oh, this child doesn't have a communication deficit because standardized testing indicated that their language was within normal limits, okay? Don't see it as much. I used to see it more often. I haven't seen it in a while, so that's pretty good. There are some what we call pragmatic standardized assessments. One's called the test of pragmatic language. And those they're okay, but they don't really, they are also not assessing communication in context. So what they may be doing is they might be showing a picture of what you would do or say given a social situation. So what they may be doing is really assessing that social cognition, right? Do you know what do you say? What should this person say given this social situation, right? And if the child has that ability to know what to do or say given a social situation, but doesn't do it when the context arises, then that's going to miss that, okay? So what we want to do is if you have standardized assessment, make sure that you're also combining that with less informal assessments as well as observations in the classroom. And here's just a couple of what I think, in my opinion, what an assessment should consist of. So some structured testing, some observation. Talk to the parents. The parents know these kids the best, right? And they can identify, hey, this is where I see, these are the things that I see. Teachers as well, right? So get teacher report, get parent report, do a direct observation within the appropriate, within a variety of different contexts, and then you're going to probably start getting some ideas about where is this child's strengths in terms of their social communication abilities, where are their weaknesses, so that you can start planning appropriately in terms of treatment. So, and just kind of a final word here, very often we see children with ASD who have language that is within normal limits, but they have deficits in the social communication, okay? So that's where the parents here, you have to understand social communication, you have to walk into the IEP meeting and hone those advocacy skills to say, yes, I know those language tests indicated that my child's language is okay, but what we're seeing is some deficits in broader social communication issues, abilities. Yes, please.
Okay, most of the kids with autism, sometimes they repeat the whole phrase.
Mm-hmm.
It looks like typical child,
Right.
but still they don't understand what they are saying.
That's right. That's right. So the
But when that happens, sadly, when they apply for EDA, they say they are borderline.
mm-hmm. Right. So the comment was that a lot of children who have autism will do a very good job with repeating and can repeat full sentences from other people. We call that echolalia, right? And that's the immediate repeating or scripting. But they may not be able to really use words to communicate functionally. And the comment was that when they try to apply for DDA, is that what you said? Developmental Disabilities Administration. That's the new acronym that we're still learning. That they might not qualify, right? So, quick word about that. If a child has autism, that is a category for DDA. So that would be a good. What you need is to get a doctor's diagnosis or a psychologist's diagnosis to be able to submit that, so that they would be able to be eligible for DDA. Okay. Yes, please.
So with the assessments, I'm just wondering with families with children with families who are bicultural
Mm-hmm.
or bilingual or maybe multilingual,
Yep.
if you're trying to like see like where the language is at for the child, is it done in both, like say native language and English, or is it just mainly in English because schools are going to be instructed in English
Right.
and whatnot, or like how does
It's a good question. So the question was, for bilingual children, how do they measure their language abilities? Because if they've been speaking one language like Spanish, right? How do they do the evaluation in both languages, or do they only do it in English? And it kind of depends on the district. Certain districts where there's a large Spanish-speaking community very often will be doing evaluations in Spanish. Tri-Cities, for example, is a place where I hear that and I read reports that the evaluation was conducted in Spanish, right? But more often than not, they don't, right? And the evaluation is done in English or through an interpreter. And what really needs to be noted during that situation is that we know that the child had this evaluation may not be 100% accurate due to this complication. Okay, that answer your question? Okay. So, any other questions about evaluation, please?
How would you handle a situation where the school district says they don't qualify based on their levels of
Mm-hmm.
qualification, but say at Children's Hospital or Valley Medical, they do qualify for it. So do you just ask for retesting, or do you just let it go?
Yeah, well, that's a great question, and I think that occurs a lot, right? My experience is the school can really kind of do what they're testing, and if you feel like that they haven't evaluated what they should be evaluating, whatever they're testing didn't capture what you wanted it to capture, right? Then you can make an argument that the evaluation wasn't accurate, right? You can request a reevaluation, and you could even request that they complete more of a social communication evaluation. Okay, that's one thing that you could do. Another thing you could do is you could request an IEE, right, which is an independent education evaluation that would be completed outside of the school. Okay, you could take your children's hospital or outside report and share that with them and say, well, this report does indicate that there's something, that there are issues or there are deficits, and some schools will do that. We'll say, all right, well, I see that, or maybe we can do our own assessment that is similar to this one. So you do have some evidence that indicates that there is an issue. So I guess I wouldn't let it go. And that's where you kind of figure out, are there other kids that are in your district that are receiving therapy based, due to social communication, I would pull, the new DSM-5. I'd bring a little copy of it and say, hey, this is what is difficult for my child. There's a diagnosis here, right? This is what autism is. This is what we need to be able to do to address it. Okay. Any other questions about evaluation? Okay. So what I'm going to try to do for the next 40 minutes or so is we're just going to talk a little bit about some of these foundational aspects of social communication and how we see the difficulties manifest themselves, the social communication deficits manifest themselves in a child's behavior. We're going to start really young, really, really early, but we're going to go all the way through conversations. And as I said earlier, I'm not going to be able to hit everything, but what I want to do is just touch upon some of the different ideas, some of the different issues, give you some ideas about a strategy or two that might be helpful, and then maybe right here and just show you some different goals that you might be able to put on an IEP or have as your own personal goals for your child, so that you might be able to target some of these deficits. Okay, so when we think about the foundation of social communication, what we're thinking about, and this first word is really, again, what we think about as being hard for many kids with autism, and that is the ability to be engaged, right? So joint attention and imitation are the other two areas that we think about as being these really early foundational skills on which social communication skills are built, okay? And what I'm going to do is kind of talk a little bit about engagement, and we'll talk a little bit about what joint attention is. So engagement is this connection, right? This feeling, right? In many ways, you have it's like a feeling that, oh, I feel connected with this person, right? Something that you might ask is, well, what is my child's motivation to be social? Do they have a lot of motivation to be social, or are they kind of interacting on their own terms, right? Are they interacting kind of only because they want something, right? You want to think about how do they initiate socially, right? Are they initiating for a variety of different reasons, or are they only initiating to get the things that they want, right? How often and consistently do they respond to the social initiations of other people, right? Is it dependent on what the activity is, right? Sometimes I'll do an evaluation, right? And one of the things that I do over at Children's is to do the direct evaluation with kids during a diagnostic process. And I'm working really hard trying to get them to be engaged with something, got some toys. They're not interested. They're kind of over here. They're not interested at all what I'm doing. Then I pull out the bubbles, right? And I got these bubbles, and now I've got a new best friend, right? This guy, like, he's looking at me, he's smiling at me, right? And just because I got something awesome, right? And I blow the bubbles for a little while, and we've got this great interaction. You're feeling really engaged, right? I feel like he's paying attention to me, right? I can even get him to do stuff. I can get him to say things, right? But then, as soon as I put those bubbles away, and I'm like, all right, let's play with this frog, right? And they're like, boom, gone, right? And I've like lost my new best friend. So this is something to kind of think about, right? How easy is it to engage with this child? People who work in birth to 3, this is a really good question to ask, right? How easy or difficult is it to sustain engagement with this child, okay? And the ways that we really think about it is, and one of the measures is, how often do they look up? What is their eye contact like, right? How well do they pay attention to other people? And this idea of joint attention is another area of that's just one of these foundational skills. And joint attention is, in many ways, this sort of primary way that children learn, right? And what we do as a test for it when we're doing an evaluation is I might just say, hey, look over there, right? And you need to be able to, when I point to something and look over there, you should think, oh, there's like this invisible line from my finger over to whatever object it is I'm pointing to, right? And a child, and that child by about 12 months of age should be able to follow that point when I point over there to something. All right. By 18 months, if I go like this, and I say, hey, check that out. Look over there. All right. Just by turning my head and looking towards something, a child should be able to look at me and then shift their attention over to something over here. Okay. So we call that responding to joint attention. All right. A child has to initiate joint attention the same way, right? They need to point to something. They point to something and then they look at you, and before they're even using words, they might say, right? And they want you to look at something that they find interesting. Okay? So there's a connection there, and this is a foundation skill for commenting later on, being able to make a social comment about something that someone finds interesting and share that interest with another person. So when you're looking at books, right, you could sit there and look at books together, right? And one of the best activities for a 2-year-old, a 3-year-old, is just sitting around and reading a book with your mom or dad, right? And if I'm pointing to something, a picture in the book, and they are able to, I point to the picture and their eyes go to that picture, that's an opportunity for me to say, oh, there's a train, or there's a hippopotamus, right? So that's how they learn language, is through this shared joint attention. And the research has shown us that children with autism have a delay in this, right? They do not develop shared joint attention by 12 months of age where I point to it. They do it by the time, by just a simple, by following an eye gaze or a head turn, right? So that area is is deficient, and that's a really good goal in birth to 3 centers or developmental preschools if your child doesn't possess this ability to shift their attention, right? To look and share attention with somebody around an activity or something of an object of interest. That's a really good goal. Okay, so and these are just this is some examples. Okay, so on an IEP you could write something like, a child will respond to attempts to shift his or her attention via pointing or by shifting eye gaze. Okay, one thing that I love to do is I'll just sit there and look at books, right? And I'll just kind of point to different pictures, and and really just kind of I'll touch the picture, and then when they turn and when they move to that, their eyes move to that picture, it shows me that they're shifting their attention. Then I might say the word, right, or kind of praise them in some way for pointing for shifting their attention that way. Okay, much harder is teaching a child to initiate joint attention by showing objects, right? More often than not, children are communicating for the reason, I want something or I don't want something, right? So we're not going to talk, I'll try to give you a strategy that might be helpful, something that we could use for that. Okay, and I just think a lot of modeling here, a lot of practice in context is really, really good. Looking at those, as I said, looking at the books together. If you're out and about, you're walking through a park, right? You're at the zoo. A lot of opportunities of you pointing things out, right? I want to show you this. Take a look at what I have, right? And trying to see and then another good idea is to sort of, if you have two parents in the home, hey, go show daddy what this is, or go show mommy, right? And then mom or dad's reaction could be what is rewarding or motivating, right? Because you make a big deal when they come and bring you something. Okay, so one of the things, and when we talk about commenting later, we will talk a little bit more about this importance of initiating joint attention and a strategy that I've found to be successful with that. Okay, so any questions about that early joint attention? Yes.
I know there's differing opinions, and I battle with it myself in my class about focusing on the eye gaze,
Mm-hmm.
eye contact. I'm currently reading Carly's Voice.
Okay.
And I'm sure you know who Carly Fleischman is.
Yes.
Okay. And she says in her book, as an individual with autism, you should not require individuals with autism to look in that because it is so painful for them. It's a lesson in the curriculum we use, and I thought about just getting rid of it because of that. I'm wondering what your opinion is.
Yeah, so the question was about eye contact, which we are going to talk a little bit more in depth, but the question was, and it was Carrie Fleischman, right? Was who you said, right? Carly Fleischman's book indicates, suggests that you don't make a child look at you. Because making eye-to-eye contact is painful, all right? And we've heard that from some kids, some people with autism will say that, right? But it doesn't mean that we're not trying to encourage it, okay? And I guess there's a difference between making someone do something and encouraging them to do it. And, one of those myths is that about what autism is that they don't make eye contact. They do. Lots of children with autism make very nice eye contact. What they don't do is use it consistently, right? Or maybe not at the appropriate context, right? So when we get to eye contact, I'll talk a little bit more about that. But it's a good point. And if I felt like a child was truly averting their eye gaze and it was so painful for them to make eye-to-eye contact, I might hold off on that. But that's a case-by-case situation, right? Most kids I've experienced don't have this where that it's so unpleasant. But, every once in a while you do, right? And you try to figure out, all right, well, I'm not going to push this here because this might really cause some negative developments, right?
I have a kindergartner who, even in books, when he sees like big eyes, he goes like this.
Right.
So he doesn't see, or when he's talking to you, he'll go like this.
Yeah. And that might be like a hypersensitivity to something, right? So you kind of, you start wondering, does he just have a visual sensitivity to eyes? I mean, someone was saying that, someone today that I was talking to and had a real hypersensitivity. I can't remember what it was, but it was something about pictures of faces on TV, but it was only on TV, right? And maybe yeah, right. So and it was kind of like there was a certain context that they were really avoiding, right? So maybe it's something to think about with an occupational therapist and say, do you feel like this is more of a hypersensitivity to eyes, and maybe there's some desensitization that you could do to kind of just get him used to, starting with eyes and books might be a good place to start, right? Because the eye-to-eye contact with peers or adults is overwhelming, right? Sure. So we're going to move on to, sort of our next step here. So if we think about that joint attention, engagement level, then we start thinking about, all right, well, a child has to communicates intentionally for a variety of different reasons. So a good question to ask is, well, why do we communicate, right? And this is a really good, when we're doing an evaluation, this is something that very often we want to list the reasons that a child communicates. And these are just some of the examples, gaining attention, making requests, making social comments, saying hello and goodbye, right? Protesting, responding to what other people have said, all right? And you've got to be able to coordinate the words, the gestures, and the eye contact for all of those, what we call communicative intentions. Most often what we see at an early age is a child communicating for their own needs, right? They might communicate just to get the things that they want. They might communicate pretty well to tell you, no, I don't want that. Sometimes protests are hard, and let's talk a little bit about what protests often have an emotional component to it, especially if they are really, they're at the park and they don't want to leave the park, right? And you say, all right, John, it's time to go to the park, and now they're upset, right? And we all have sort of limited resources that we have, and sometimes that emotion kind of trumps their ability to communicate using language, right? So even though they might have the word for no, and they might be able to kind of reject when you just offer them something, in this moment, they can't access that, right? And then you see a behavior like falling on the ground or protesting loudly, screaming or yelling, right? Or even something like hitting, right? So very often children with autism are pushing things away. They might even pry your hand off of something. I've had kids who've got this vice grip, and they just take your fingers and pull them back and are really quite good at getting what they want, right? But you might have more appropriate ways by, shaking their head or saying no. So there's a variety of different ways that we communicate no, right? One of the hardest things, I think, to teach is what we call social commenting. And what commenting is communication for really just a purely social reason, right? I'm not getting anything when I pick something up and say, hey, take a look at that, right? Or if I point to something and say, hey, take a look at that, isn't that cool? Or I bring you something that I've done. I just drew this picture for you. Or I just did this puzzle. Come look at what I did, okay? This is a different reason for communicating, right? And it's not I want something. It's not no, I don't want something. It's, hey, I think this is cool, and I want to share this with you because I like you, right? So a good question to ask is, when you hear them labeling things, are they communicating just to label them, or are they communicating for more of this social purpose too? So that's a really good question to ask, because sometimes we have the kids who will just kind of, oh, that's a chair, there's a table, there's a clock, I see the numbers, 1, 2, 3, 4, 5, right? And that might be misconstrued as like a social comment because they're not really asking for things, but there's not much of a social connection there, right? So there's a kind of fine line between there. That's why I put that up there. Kids might show objects, they might point to things, they make these verbal comments, and this is where that joint attention is important, right? So if you don't have joint attention skills, it's going to be hard for you to learn to make social comments to other people about things that you see, because they haven't learned, I point to something, I look back at somebody, and that's the sharing that goes on, okay? So one thing that I like to do, here's just some goals, okay? Increasing the use of increasingly sophisticated communication to make requests. So, whenever we're thinking about how a child communicates, we want it to be a little more sophisticated, right? If they're just taking things and handing it to you, then you want them to use words to communicate, right? If for a protest, if they're using behavior to protest, then you want to make sure that you're saying, all right, well, use your words, right? Try to get them to use more sophisticated ways with more calm behavior to protest, right? And then this increasing use of social comments to share interests. And here's an example of something that I've found to be pretty effective, okay? And this is something you can do within the context of classrooms, or you could do it at home. And what it involves is really just kind of identifying what your child's interest is, right? So say they love, Thomas the Train, right? Or they love animals, or it could be anything, Dora the Explorer, or Pokemon, right? And we want them to really start using more commenting, right? They just don't do it. So you use those interests, right? And if you have themes in school, so you guys have a kindergarten class, and the theme is animals or theme is weather, right? You can do something very similar to this. And this is where you might go to Google Images or somehow get pictures of those things, print them out, and then what you do is you just create this game. And what you're really doing is creating a social routine that involves finding something, right? So take that picture of Thomas the Train Engine, put it on the wall, right, in your home, right? Put it on the mirror in the bathroom one day, right? And when, and they love Thomas, so when they see Thomas, they're going to be excited. So you point it out, so you can even work on some joint attention. Oh, look, I see Thomas. Thomas is on the bathroom mirror today, right? The next day, Thomas isn't there. Thomas is on the kitchen cabinet, right? Thomas is on the television, right? Thomas is, in the car, right? So you maybe laminate this Thomas so he can stick around for a while, right? So, but what you're doing is you're creating this routine, right? And you do it every day, right? And at some point, the child, your kid's going to come up and they're going to walk down the stairs, or they're going to, come out of their room and there's Thomas on the wall, and he's going to say, "There's Thomas," right? Because you've set it up. You've set up this opportunity by creating a routine around it, okay? If it's animals in this classroom, find out what those themes are that are being used in school, right? Try doing that at home. If they're reading Brown Bear at school, right? Use that, right? Get a picture of Brown Bear, and technology today, you can get any picture of anything, anywhere on the internet, right? It used to be I had to photocopy the stuff and I'd have to cut it out and create something. Now I just go to Google Images, find it in 1 second, print it out, boom, done, right? So that's one idea, right? Again, if you, go ahead, you have a question? It doesn't matter, right? I mean, if your child has interest and you feel like they've got some of this basic joint attention skills, then go ahead, go for it, right? Especially if they have interest in, you feel like they're interested in something, I would start at a very early age. Okay. So, any other questions? The question was how early to start with that. Yeah.
How do you generalize that? So, how do you do from Thomas to just being out in a crowded environment and making a social comment?
It's a good question. And I would do a lot of modeling, right? So you're doing social comments. And again, if you have, multiple people, right, you can be like this communication coach, right, where you say, oh, look at that. Look at there's a helicopter up there. Go show daddy. Let's go show daddy. And you really kind of helping them walk up to dad, pointing up and saying, look, dad, there's a helicopter. And then dad makes a big deal, right? So you'd be doing that anyway too, right? So that's just a strategy that I've seen be effective, but a lot of modeling, and a lot of times this is just based on context, right? So when they make that comment, maybe it's rare, right? Make a big deal out of it, right? Make a really huge deal and just kind of say, I love how you're sharing that with me, or thank you for telling me that, and trying to reinforce that by praising it, being very specific about the praise too. Okay, the question was how to generalize that. I'm sorry, I need to remember to repeat the questions for you off in the other places. So, any questions about communicative intentions? We're going to move on a little bit. I think we'll see what we're talking about next. I think it's nonverbal communication. So we'll talk a little bit about eye contact. Okay, so. And this is my sort of project. This is, if I was going to get on a soapbox this evening, it'd be really kind of talking about how important nonverbal communication is. I rarely see a goal on an IEP that says we're going to be increasing eye contact or increasing use of gestures or interpreting facial expressions in other people, right? Those are great goals, right? And there's ways to kind of to make those goals good goals, right? But I don't see it that often. So this is where I encourage people to say we need some goals that are focused on whether they're whole classroom goals or they're specific goals for kids. Trying to target some of this nonverbal communication because I think it's something that we're missing a little bit. So. And just these are the ones that when we think about the skills, those nonverbal communication skills, what we think about is eye contact. We think about how facial expressions and gestures. So we'll talk a little bit about these, and then we'll talk kind of specifically about eye contact a little bit more. Okay. And eye contact. Did you have a question back there?
Did you say that eye contact can be a good goal in an IEP?
I do believe that we should have eye contact as a goal.
The only reason I ask is we actually brought that up in an IEP meeting,
Yeah.
and we were kind of told that it's too hard to take data on it. So they basically told us.
I've got some. There's a couple. I mean, it is hard, right? And with eye contact, it's tricky because, what are you going to do? Say oh, you're going to speak. You're going to so and so will maintain eye contact for 6 to 8 seconds, and that gets really weird, right? If I'm sitting here talking to you, and it's 6 to 8 seconds, you're this guy's a weirdo, right? So that's not a good goal, right? But it's kind of what I think about is how do you use eye contact effectively, right? Sort of in context, right? A great example, and I'm just kind of getting ahead of myself, is when asking for permission for something or to do something, right? Lots of times kids don't coordinate eye contact when they want something, when they're asking for something, right? And that can be that's a very measurable goal, right? To do it within that context, right? So, And qualitative data is okay, right? If you kind of feel like, oh, so-and-so is making more eye contact, while they're having conversations, checking in with other people, it's certainly something that I don't see any reason not to target it, right? Even if it can be tricky to measure, there's no reason not to try. So, and why is eye contact important, right? And it seems maybe intuitive, but it is how we kind of pay attention and read, interpret what other people are doing or saying, right? It's how we gather information, right? And it's this coordination of eye contact with other communication abilities that really makes us social. It's what makes us social beings, right? Is being able to, that's how we feel engaged with other people. We all know people who don't make the best eye contact, right? And, you always kind of feel like there's a little disconnect here, maybe, when you're not really kind of engaged with some people, okay? Facial expressions. This is how we communicate emotions, right? And what we see in children with autism is often we could see, these emotional extremes. Another myth about autism is that kids don't smile, right? Most children with autism, I would say almost every child I've ever worked with who has autism has a beautiful, gorgeous smile, right? That lights up the room, right? Maybe they don't use it that effectively. Maybe they don't coordinate it really well with eye contact, but it happens, right? So what they might have a harder time is more of those subtle facial expressions. Disappointment, right? A little bit surprised, feeling sad, right? Maybe lots of times parents will say, well, I don't think my kid feels sad. He gets really frustrated or he gets really happy, but those in-between emotions, we don't see that often. And a big thing, just kind of one more point about facial expressions and even gestures, I feel like it's even if they're not great at using facial expressions and using gestures to communicate, what we want them to be able to do is interpret what those facial expressions and gestures mean in other people, because that's where you might miss out on social cues. You might miss what the kind of relevant situation, in terms of the context. Okay. And gestures as well. The first one is pointing, right? We want our kids to point. Lots of times pointing is a goal, right? And then there could be waving and nodding their head to say no, nodding their head to say yes and shaking their head to say no, right? Aware, where's daddy, right? Something like that. And as kids get older, their gestures become more descriptive, right? Something's really big, right? Or that plane was really fast, right? And we are able to use those those gestures, right? Even this one, like this happens on the playground. You go to the playground, you see this all the time, right? And the kids need to know what that means, right? So what we'll do is, let me see if I can get this to work. So let's see, I think we got time to watch one of these. There's a really good study that was completed that was called the visual cliff. Has anyone heard this study? Okay. And what's cool about this study is what this researcher did was he was trying to take a look at how early children use eye contact to gain information from other people. Okay. And what he did was, let me see if I can get it to work. Let's see. Just rather than repeat this. All right. It's really
Emotion is a nonverbal language.
So it's kind of cool.
Emotions reveal the cognition, the understanding of the baby. And furthermore, emotions are the nonverbal communication of the baby towards the parent and the parent towards the baby. Therefore, I thought that emotions were one royal road to the study of the baby's development.
In this study, babies between 9 and 12 months are brought into the lab and placed on a large plexiglass top table. Half of the table has a checkerboard pattern just underneath the surface, but halfway across is a visual cliff, which the baby can tell drops off steeply. The plexiglass top continues, so it's perfectly fine to proceed. But the baby isn't so sure. And this is a big drop for a baby just starting to crawl. She wants to get across to get the toy. But she's cautious and looks to the opposite end of the table where her mother is. The parent is instructed to smile or make a fear face.
If the mother is posing a fear face, the baby typically does not cross this stair step downward, this modified visual cliff or visual step. On the other hand, if the mother poses a smile or somehow poses a nonverbal communication that is not prohibitive but encouraging, the child is much more likely to cross over to her. This particular study demonstrates the role of nonverbal communication in determining the child's behavior in uncertain contexts. A baby will, when they encounter something ambiguous, something uncertain, will typically look to the significant other, the mother, the father, a grandparent, the caregiver, in order to figure out what to do. So by 11 to 12 months of age, the baby is already doing what all of us do when something unusual happens. We look around to figure out how other people are reacting.
Okay, isn't that neat? So, and these are kids who are under 1, right? And that's just a good indicator of how early and how important it is for children to use eye contact to learn about their environment, okay? The other one is pretty cool too. If you have a chance, type it in and find it. It's actually funny, and it's also like, it must have been made like in the early 90s or something, so there's wonderful 90s era haircuts and glasses that are really fun to watch. So eye contact, how do we encourage eye contact, right? Because again, you don't want to make them, the comment earlier was, how do I make a child look at me? I wouldn't suggest making them, okay? And I'd even avoid saying the look at me. A lot of parents will say, oh, well, look at me, right? I would use that if only as a kind of last resort, right? And what's kind of more effective is trying to engage them around, becoming interesting to them so that they kind of look up to you and you become sort of an interesting object to them, for lack of a better word. Has anyone heard of RDI, relationship development intervention? That's a real strong component of that treatment strategy, is to become interesting to your child, okay? Indirect cues, when we think about how we're going to try to encourage them to do it, to look up. Sometimes what we do is children they become pretty good at sort of understanding the words of other people, right? And they might not use, they become pretty good at using words to communicate, but maybe they're not using their eyes because they're focused on something, right? So, for example, a child might be playing with their toys or, looking at the computer, and they want a drink, and they say, oh, Mom, can you get me a drink, right? But they're not kind of using their eyes at that time to kind of look up and make that connection, right? So one thing we can do is what we call using an indirect cue, right? And an indirect cue is really just kind of, I'm going to wait a little bit. I'm going to be intentionally pausing here. And this is one of the hardest things for parents to do. And if you go home and try this, you're going to be like, wow, it's hard, right? But what you want to do is you want to just kind of, I'm going to wait. I'm going to stop. I'm not going to talk. I'm not going to respond, okay? And then what you might start saying, oh, well, what did you say? Or using some sort of verbal cue that's not look at me when you're talking, okay? Because if we can get them to look up and say, oh, can you get me some juice or get me some water, right? And then you're like, oh, now I know what you're saying, right? Thanks for looking, or something like that, right? That connects, that they start making this connection between using their eyes to communicate, okay? And I will kind of mention a program later called social thinking. Everyone heard of social thinking? Yeah. Social thinking it really targets using your eyes to learn, right? Looking for social clues, right? And it can be a really effective strategy to encourage eye contact. Now, I would be lying if I never said if I said I never have said look at me, because I have. And sometimes that's what that's what you have to do. Lots of times people will use this one, right? I'm getting a little closer, and that's fine. Maybe they want some water, or they want something, and you bring it up here a little bit, and then when they kind of look over, oh, I see what you're saying, right? But again, that's still a prompt, right? And maybe you try to see if they'll do it without you doing that, and that becomes what you do later, and then you say, oh, remember to use your eyes or something like that. Okay? Eye contact is hard, right? And a lot of times it's something that we're continually working on, right? But it's worth working on, because eye contact is how we gain information about our world. And if we want our kids to be effective, reciprocal social communicators, and they need to be able to do that, right? And you're right, there are times when you might say, I'm going to hold back on eye contact. And I've had kids in treatment where I've told the parents, you know what, let's not push it right now, right? Right now is, let's just see if we can get them to do it during really highly motivated times. So, yes, question?
So that's what I kind of feel that my child is not really looking or not interested in the environment wherever he is, because he's doing his own thing.
Mm-hmm.
But then I found out several times that he knows what's going on.
Right. Right.
Which is, it kind of freaks me out.
Yeah. The comment, yes, there's a good one. The comment is her child doesn't seem to be paying attention, doesn't seem to be using eye contact. You feel like they're not paying attention, but then it turns out that they are, and it freaks her out. So, and that's true. A lot of times kids are kind of paying attention to the environment, and that's good information, right? Because then you can kind of say, well, you could even almost in a teaching type of way, talk about why is this important to look. We're working on looking when we're communicating, right? If I call your name, you're supposed to look up, right? If they've got the ability to that you recognize that they are able to do that, that allows us to say, hey, maybe we can push it a little bit further, right? If it was truly a difficulty with engagement, then you got to almost go back to where we started at the beginning, right? Where we're working on shifting attention, right? Engagement, responding to other people, and that's sometimes what we've got to go back to in certain cases, right? So it's a great comment. Any other questions or comments? We're going to move on to kind of higher level social communication stuff. Okay, and here's just some general goals. Increase coordination of eye contact when asking permission. I love that goal. I think that's a great goal. And if that's where you start for eye contact, then great. Okay. Understanding of facial expressions and gestures during social interactions. You can do an ABA program if you want with understanding facial expressions, right? But the point is generalizing it to appropriate contexts, right? Generalizing it during a social skills group, generalizing it during preschool or a recess or any social situation. Okay, so now we're going to, for the end here, we're just going to talk a little bit about what we think of as precursors to conversations, because when we get to conversations, that's it. That's the ultimate prize, right? We've reached the top of the mountain if a child is able to have a quality back and forth conversation with somebody, okay? But there's foundational skills here too, right? And what goes into conversations is being able to ask and answer a variety of different questions, right? Answering questions that involve a little bit of thinking or processing, right? So a really simple example here is, if I'm looking at books and I see a bunch of pictures and I'm just saying, what's that, right? If there's a picture of a boy and he's got a hat on and I say, well, what's the boy wearing? That's a different question, right? That question involves a little bit, just a tiny little bit of thinking. What's the boy holding, right? Just a little bit of thinking or processing, right? So, and questions like why and how. Those involve quite a bit of thinking about, right, in terms of trying to figure out how to respond to that. Relating personal events, telling stories, right? We need to be able to do that. We need to tell our own personal stories, right? Asking what we think of as relevant questions, right? Sometimes kids do a really nice job of asking questions, but those questions aren't necessarily appropriate to the context or appropriate to what someone else just said, right? If I said something like, "Oh, well, I was walking on the beach last week and I saw something really cool," right? The thing that you're supposed to say right there is, "What was it? What did you see?" Right? A lot of kids might just say, "Oh," right? Cool. So I hear that one. That's a new one I hear all the time. Cool. So, and be able to take appropriate turns during conversations. Okay? So let's talk a little bit about telling stories, producing narratives, all right? And what we want is to be able to talk about past and personal events. A really good question. Once your child has some decent basic language skills, can they talk about what happened in the past, right? Can they tell you a story about what happened at school today? What happened when you went out to the park with dad, right? What happened when you went to visit grandma with mom, right? Can they relate what those stories are, right? Outside of what's here and now, okay? Often we have kids maybe they'll be able to take a part of that, but they have a hard time and may get overwhelmed with the kind of the need to organize or sequence, right? All those different things that happen, all right? Often reading a book. Hey, we just read this learning to read book, level 1, level 2 reader, right? Tell me what happened in that story, right? That can be really, really hard. So this is a good goal, right? Being able to relate to personal events, retell stories, okay? What I like to do is a really good strategy that I think families like as well, and now we all have these cameras in our pockets everywhere we go, right? Is use that, take that and create books or create, if you're really technologically savvy and you can just do it on your phone or your iPad or some sort of device, great, right? But what's nice about it is it uses that visual component that we know is a strength for many children with autism, right? That strong visual processing. And it also, what does that visual links to what is often quite a good memory, right? But for some reason, it's hard to organize. Maybe it's an executive functioning difficulty, right? Being able to kind of put the events in sequence. So say you go to the zoo, all right, or you've had a birthday, snap some pictures, right? Take some pictures with your phone, and then after the fact, come home and say, and you say, let's tell mom about our trip to the zoo, right? And what you want to do is you want to help support it. So they're not going to be able to do it the first time, right? You might be telling most of the story, right? But letting them finish it. Or maybe there's a really good picture that helps to kind of help them remember. Oh, remember what we saw first? What did we see first? Oh, we saw the wolves first. What happened after the wolves? Do you remember? Remember we got something to eat? Yes, we got ice cream, right? We got some ice cream, and then we went on the carousel, or whatever, right? Vacations, any sort of special holiday type of trip. These are great opportunities because they're outside of what is routine, right? And they provide a great opportunity to tell those stories, right? I'd provide a lot of opportunities and models for yourself. Let me tell you about what happened today, right? I saw something really funny today when I was at work or something like that, and start telling your own stories, or even tell stories about what you were, what some of your experiences when you were young, right? Some funny stories or some stories that are going to be remembered, right? Those are all great to do in terms of providing models. Okay, and these are just some goals in terms of narratives, increasing the ability to sequence parts of a story. Relating elements of a picture book, right? Increasing the ability to retell those stories from books after the fact. So maybe you do it during, first you work on telling the story while looking at the book, and then later you've read the whole book, and then you start working on relating or retelling the story, and then just increasing the ability to relate personal events. When I'm in therapy, if I'm seeing kids for therapy, I have parents send me pictures all the time. I was like, send me the pictures of your weekend. Send me the pictures of when you went skiing or when you went to the beach, right? And then I can take that. So if you have a speech language therapist that you're working with, see, hey, can I send you some pictures that you might be able to use? That's a really good idea. Okay. And then our last area here is really just kind of talking about conversations. All right. So we've worked on, we've been working on asking and answering WH questions, and we've been working on being able to tell stories. Right. Now what we got to do is we've got to have this reciprocal. There's that word again. Verbal exchange of information, right? Personal stories, sharing socially, right? That's what conversations are. When you have a conversation with somebody, what it involves is I say something, you have to judge what you know about that. You ask me a question, or you share your own personal story about those things, and then it goes back and forth, right? Taking turns. We're not interrupting each other, but we're also not always waiting for the person to finish either, right? Conversations are often I'm saying something and then someone else starts talking right towards the end of what I was saying. I have to judge when someone's almost finished saying something, so then I start saying something, right? So there's a lot that goes into it, requiring paying attention, the ability to take perspective, all of those things, social knowledge, the ability to respond, the ability to initiate, right? Then understanding what these questions, having good language skills, all of that goes into the ability to have an effective back and forth conversation, okay? So I think I kind of mentioned a lot of these already, as well as the nonverbal stuff, right? So not only are you listening to what people are saying, but you're looking at them, you're gauging their reactions to what you're saying by their facial expressions, nodding to acknowledge. You're going to change what you do based on what what information your partner gives you, right? If they frown and look confused, then that's information that I need to use to change what I'm going to do, okay, and adjust to the context. So one thing, and this is a bit kind of early in terms of conversations, but what I've found to be an effective strategy is especially when a child starts to learn to read and it starts becoming even just basic reading, okay, I might be able to use those reading skills to help structure conversations. So almost like I'm writing the conversational turns down in a play or something, okay? So what I might write is I might write Jim, and I might say something like, I just got back from the airport, okay? And there's a whole slew of questions that you might ask about that, right? So, and then they might say something, and I might say, hey, you know what we're working on? We're working on asking good questions, right? And then I say, oh, I just came back from the airport. Maybe they have a hard time coming up with those questions. Maybe I'll write down at the bottom of the page, here are all the question words. What, where, how, when, who, why, right? Let's try one of those questions, right? Why did you come back from the airport? Great question. I had to pick up my mom, right? She flew from really far away, right? So I'm setting up lots of opportunities, right? What do you say then? Anybody? Where did she fly from, right? She came from Rhode Island. Where's that, right? So there's a lot of different things that kind of go in. And the great thing about this is that you could start with the same thing but have a completely different conversation the next time. So you're modeling the fact that conversations don't always go the same way, right? And what you can do is you actually can almost kind of analyze it, right? If they said, I went to the airport, what gate did you come in on, right? It's a question, right? But is it the most relevant question? Is it the best question in that situation? That allows us to kind of talk about it. And when they see it and we look at it and I say, is that the best question there, right? Now let's cross that out. Let's try a different question, right? And yes, it's a little fabricated at the beginning, right? But what it does also is if you read it as a play, right, then you almost get this feel of what it's like to have this back and forth conversation, right? And of course, we want to generalize that to more kind of appropriate or context-based conversations, but it's good practice, and I've had success using that in some of the kids that I've seen. So another really kind of good, it's just made me think about it is as kids get older, so kids who are 9, 10, or 11, there's some amazing opportunities in using drama, right? Drama is such a great opportunity for perspective taking, right? Taking the role of somebody, being able to have and practice this conversation, right? Within the context of theater play. And there's some very nice groups in the community now that are working with kids who are on the spectrum doing theater. There's a great group up north that does improv with kids who have autism, right? So very cool stuff, and it's very interesting, and it can be really helpful for a lot of kids who are on the spectrum, okay? And here are just some goals, right? Maintain topics across turns. Sometimes we see kids who just have a hard time really being able to maintain the topic. What they'll do is they'll just talk about and go off on their own train of thought, or kind of interrupt and want to talk about what they're interested in, okay? Increasing that ability to ask relevant questions is a very measurable goal, right? Being able to recognize the communicative intent and interest of others. And this is where it comes down to, right? Being able to modify, maybe not talk too much about something, but talk enough. Asking good questions, being able to relate a story of your own that is appropriate to the context, right? Those are all things that we can kind of target and just be specific if you kind of do an evaluation and recognize this is where this child's conversational abilities are, this is what we need to do, okay? And then we kind of think about higher level conversational skills, and there's this big complex system, right, that involves all of these things, right? And that's where we want to keep pushing, right? Say a child graduates from speech and language therapy. We want to be able to use these skills within the context of a social skills group, or within the context of regular interactions with kids, within a classroom project if the child's in regular education. They need to have these skills to be able to be effective in terms of their social abilities. Okay, so last couple of slides here, and then we can spend some time talking about questions. These are certainly worth a look. Okay, for younger kids, take a look at the Hannon Center, and specifically a program called More Than Words. Okay, for older kids, the social thinking curriculum, which I mentioned earlier, is definitely worthwhile looking. And really, this is kind of my take-home message here is, social communication, you can't change this in 1 hour of speech language therapy per week, right? It really needs to be kind of a big parent-school therapist collaboration, right? So that we're all kind of focusing on encouraging more sophisticated social communication skills, okay? And really needs to kind of be taking place 24/7, right? And then I believe that we need to have more specific social communication goals on IEPs in schools within the context of developmental preschools all the way through school. So that's it for what I have. I'm happy to answer questions. We got a question right here, and then I'll probably go after this one. I'll probably go to ask the people at the other sites if they have any questions.
You said that there was an executive function thing last year. Is there anything else?
There isn't. This year is the first year that we had the videos that have been taped and put online. We will have executive functioning maybe next year. Okay, because it's a very important and popular topic, so that's a good question. So, are there any questions from any of our remote sites? Any from any places, Washington, Alaska, Oregon, that want to have a chance to ask a question? No. Is anyone out there? Okay. How about you guys? You over here.
What would you suggest helping family members redirect a child that's very focused on something when they're communicating with them? For instance, they're
Right, right, right.
like that. So how would you help sort of non-professionals redirect, and what would your
It's
methods be
a,
for helping grandmas and grandpas
yeah.
like that?
That's a good question. Grandmas and grandpas want to help, right? They love to help, but they're not sure how to, right? So, and the question was, how do you redirect or help other family members to 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 encourage something that's a little more when a child might get really focused on something, and this is something that we see a lot, right? Children getting hyper focused on a specific topic and just wanting to talk and talk and talk about it, right? So, I think it's okay to. I would say, it really is hard to kind of to know when, and this is one of these great context questions, right? But when a child is really perseverating on something, I think it's fine to acknowledge it once or twice, but then say, let's see if we can engage around something else, right? You can even make some very specific rules about, all right, well, we talked about, let's talk about the fire engine for, one time or for 3 more minutes, okay? But then we're going to talk about something else, and maybe even making some choices. Do you want to talk about the animals you saw at the zoo, or do you want to talk about something else, right? Some game or some movie that you like, right? So it is tricky, and I think that a lot of times parents and everyone who's working with a child, they want to go along with that communication, right? And sometimes we encourage perseveration by continually responding to it, right? So if that's your kid, you want to kind of sort of say, all right, well, I will do this, but we're going to try to set some limits, and let's talk about that, and then we can go back to fire engines later. Okay? Does that answer your question? Okay. So I've got a question back here.
How important is it to, or how often should we seek this out, to have these conversations be typical peer
The question is, how often or how important is it to have practice having conversations with typical peer models? And, I think that it's very important, right? And you just have to kind of gauge where your child is and their ability to engage with other kids around conversations. But at any time, say we're really working on conversational skills, we're specifically working on turn taking or topic maintenance or asking good questions, right? So you're going to be doing it in a very structured way, right? But at the same time, you're always thinking about generalizing it, right? You're always thinking about, how do I encourage, a child, my kid to, ask questions to somebody else, right? Finding that peer model is sometimes the tricky part. So if you've got, a friend who's got like a really bossy little girl, right, who is going to be a teacher, and wants to be mom at every time they play, right? She's probably a good one, to kind of get her involved, and that might be a good one. So, a question here. Mm-hmm.
more give and take in the conversation, more engagement, but yet in school settings and play dates and peers, it's much more noticeable that the eye contact isn't always there.
Yep.
The give and take isn't always there.
It's the question is it common for there to be some variance in terms of social communication skills across settings? So at home, better eye contact, more responsive, more social, but then has more difficulty in school or during play dates. And yes, that is very typical, right? And almost the inconsistency in social communication is part of what autism is, right? And I used this example before, but we all have our limited resources, right? And we have to tap into our resources to kind of manage even our emotions. So when you get into a classroom or there's more going on, I'm spending more time and energy, your kid is spending more time and energy really just managing themselves, right? Not paying attention to everything at once, or how do I focus on something? And then, maybe there's some sensory stuff that's contributing to the difficulty there. So that's a really good question. And when that happens, that's really important, right? Because that helps us say, all right, they're in their comfortable settings, they are pretty good. They're capable of doing these things. What we need to do is work on generalizing that to a school, right? Or maybe we start with small groups, right? And seeing how we might be able to encourage those skills that you see somewhere else in these more difficult situations. Okay? So, was there a question over here? Why don't we go with, I think you've been having your, okay, you said first. Okay, sorry.
My question is, and then I want to get to the standardized testing. Are parents today, do they have access to their child's test? Because intuitively, I know that my child was assessed at a much higher level than what he functions at in
Mm-hmm.
language. But yet I was never able to view the actual test, nor was I able to review his actual answers. And in
Yeah.
my opinion, there's a huge disparity, and I never had access, and I've always fought for it.
Yeah. I mean, you should have access to the scores. You know,
I've got the scores,
yeah.
but I want to see the questions.
Yeah,
and
yeah.
I want to see his responses, and that is top secret.
Yeah, typically they don't, testers, whether you're a school or a children's hospital, aren't going to share the protocol with parents or whoever, whoever's involved. So, if you feel like it's not accurate, right, and there's a disparity, that's when you start, like we were talking about earlier, what tests were given, what do those tests purport to measure, right? And how come when it says that his skills are here, but can we agree that his abilities don't match what that says on paper, right? And if that's true, why is that happening?
And that's a
You
good
know.
question, but then what is the reason for the tester not allowing the parent to see what the questions are?
I mean that's a great question, and I don't know if I have a great answer for it, but it's just it's just the rules that have been developed in terms of what I would have done is I would have given some examples of tests of questions that he had a hard time with and questions that he scored well on, right? To kind of, and there can be an item analysis within the context of a test that might be able to provide information about that. We'll say. So, go ahead.
So my question is, because of the prevalence of autism
Mm-hmm.
nowadays, how does this information on diagnosing or even knowing that there's something there get disseminated out to pediatricians? I felt like something was there with my son, 6 months
Mm-hmm.
to a year old, and he was so borderline. He's now classified with mild autism.
Right.
But there's so much that could have been done in those early years, but it took until he was 8 years old to get him diagnosed.
Mm-hmm.
Because
The pediatrician missed it. Yep.
he dismissed us.
Yeah. And I think that's a common story that we hear is, missing out on, some subtle signs. I think pediatricians are doing a better job now. I do believe that. I think that there's a lot more screeners. There's a lot more awareness about just doing sort of just general screens for autism as part of well visits. So, if you really, I guess this is what I would suggest to everybody here, especially if you've got young kids and you feel like my pediatrician isn't listening to my concerns, I would look for another pediatrician. So, yes, what back here?
One of our offsites.
Okay, one question from the offsites. Let's hear it. Are you there? I'm not sure. I don't know if I'm hearing you.
Hi, Jim. This is Carol.
Oh, hi, Carol.
I think I just butt in with someone who wanted to ask that question. So,
all right.
but I just wanted to just thank you, Jim, and just to let your audience know, and I know, Jim, you know about All the references you made tonight, we have in our Autism Outreach Project's lending library, the multiple books from Michelle Garcia Winner, and we also have DVD and the books for the Hannon program.
Oh, okay.
So I just, again, wanted to let you know, put the plug in for our resources that we have.
Okay, and Carol's up at the Autism Outreach Project in Anacortes, so an excellent statewide resource. They have an amazing lending library, so any book that you're interested in, contact them, and they'll send you the book, and all you got to do is send it back when you're done. They've got the videos for, as Carol mentioned, for the Hannon program, so definitely a worthwhile resource. Okay. Just look up Autism Outreach Project online, and you'll get that information. The Autism Outreach Project is how we offer clock hours for teachers. So if you just kind of stop by on the outside, there probably is some information. I know we have information about the Autism Outreach Project out there. Okay, right here, we'll probably just have a couple more questions.
So, as a parent of twins who are being kind of assessed at early birth to 3,
Mm-hmm.
one of the things that I'm struggling with is kind of the twin factor.
Yeah.
Social communication versus social communication for them as individuals.
Mm-hmm.
I was wondering if you would have any comments to share around resources or reading or kind of trying to understand that whole twin dynamic.
Yeah.
That kind of is super challenging dealing with two kids who are potentially on the spectrum.
Yeah.
Down.
It's a great question. The question was if there are comments about twins, their brothers, two sisters who are going through evaluation in a birth to 3 center, and that the kind of specific issues that might be surrounding twins. And I can't say I know a ton about that, so I'm not the best person to ask. But any evaluator needs to take a look at the situation, right? Kind of like the question earlier about having 2 languages in the home, right? It needs to be considered, and we need to be able to say, hey, this evaluation may be complicated by blank, right? 2 languages in the home, a child who relies on their twin to communicate for them. If that's information that is accurate, then that's information that should be communicated to the people who are at the Birth of 3 Center, and that should be something that they think about and consider when they are creating the plan. Okay, so let's do 2 more questions in the back. Okay. That's a really good question and a hard question. I might look to my colleague up here, David, who's a nurse practitioner, if he has anything to say. Do you want to start? The question was their child. Thank you for reminding. Their child is currently going. They're starting this journey with a child who has autism, and he's currently going through a developmental regression. And mom's worried about is he truly forgetting everything, or is everything still in there, and is coming has the potential to come back, right? So. Mm-hmm. And David's response for the people who are at other places is, there's not a lot of information about whether that what's happening inside the brain, but it's worthwhile connecting with a neurologist to see if there's something that can be identified, especially when there's regression concerns. Okay, so sorry, that's a terrible answer. One more question? Anyone got one more? Last one.
If you have a child that has a lot of processing issues and has the language, but when he's emotional or upset can't get, and you say use
Mm-hmm.
I see like the anxiety because she didn't have.
Yeah.
What do you mean?
Yeah, yeah, yeah.
So, what are some things you can say instead of use your parents?
Yeah, yeah, yeah.
I see her was really upset, or I see.
Yep.
What's super
So,
communicate
good.
without the parents.
Right, right, right. The question is that, child who has some difficulty with processing information, starts getting upset. We say, you give them a cue, oh, can you use your words? And that's almost a trigger that increases anxiety, right? So absolutely, you want to, if you identify a trigger like that, we're not going to use that, right? So maybe there's some other, some other phrases that we might be able to use, identifying, noticing, and that's the first thing that you're doing is you're recognizing, all right, he's getting upset and therefore loses his ability to communicate, right? So somehow we've actually got to work on how do you manage the anxiety, right? And if we can manage the anxiety, manage his ability to regulate his emotions, then the language, the communication should actually kind of get better, right? So, that's when you start looking at how complex a lot of these kids are, right? And you start saying, all right, well, is it communication? Is it anxiety? Is it processing, right? And most likely it's some combination of all those things that work together to create a big obstacle like that. So, maybe trying to take some self-calming techniques, deep breaths, right? Okay, let's try it again. Or, I know you're trying to say something. Sometimes you're going to provide more prompting, more support when you see that that he's struggling, and then really we want to promote success, right? So that might be what I would try, is trying to think about that. So, last question. Oh, Compin.
My son, we've got in the library, like Zach gets frustrated, Zach gets angry, and another one was something about chillax. And because it's looking at this kid's having a problem, we can go through, and if I just tell him he should breathe, or him that he should, walk or do whatever, that's as bad as saying use your words. But if you can look at this story about this boy, and what this boy is good for him and helps him, and then he does kind of, he's thinking about it and he's processing it, and who knows how many years it'll take before he actually does it, but it's progress.
That's right. Did you have a comment too?
Well, I just had a quick comment for him. Maybe, I don't know how old your child is, but if maybe they're able to draw out what they're trying to say, like have a little whiteboard, or if he's able to write, and knows how to spell and stuff like that as best as he can, maybe write it out of what he's trying to communicate.
I'm trying to think. It's usually more with like his teachers that are saying that. So something they could do instead of,
I don't know how old he is, but putting out candles, 4.5, yeah, something that teachers at our schools do. Blowing out candles and doing the safe breath, which is like, and I say that at home now, and she breathes. I mean, she might cry after, but it's less, and it gets better. So I don't know.
Yep. All great comments, and that's it's a good point to say. You can learn a lot from other parents, right? You learn more from other parents than you're going to learn from me, probably. So I think we're going to say good night. Thanks for coming out on this August night, and we'll see you next month.